Good morning, and thank you to the members of the Caribbean Cytometry and Analytics Society for inviting me to give this talk. I'm pleased to talk about a new public health vision for the Caribbean with the proviso that there's nothing new under the sun. The Caribbean region has had a long history of successful cooperation in health, and in thinking about a new vision for health in the Caribbean, I think it behooves us to reflect briefly on what has come before us. There is a program called Caribbean Cooperation in Health, or CCH, in which the countries of the region gather together to tackle and put effort around particular priority problems. It is now in its third iteration, as many of you would know, CCH3. It began in the 80s with leadership from PAHO and from the CARICOM Secretariat. And I would think that under CCH1, perhaps the most notable achievement was the elimination of indigenous measles in the region of the Caribbean. And that was a first in the world. It led the rest of this hemisphere to follow suit and eliminate measles. And the rest of the world is making good progress in that regard. We also at the same time eliminated polio, though that was not as systematically planned as the measles elimination. Subsequent to measles, effort was made to try to eliminate rubella. Of course, in trying to eliminate measles and in maintaining post-elimination surveillance, the laboratory is highly important to detect any imported cases or to detect that in fact transmission has been curtailed. Prior to CCH, antedating my time in this business, there was a program called SPAC-GEM, Special Program for Combating Gastroenteritis and Malnutrition, where again, ministers of health came together and formed a common plan to respond to a problem that many countries had. So that was pre-CCH. As I mentioned in CCH1, I think measles elimination perhaps was one of the highlights. Under the Caribbean Cooperation in Health Phase 2, there was then, it was during that time perhaps that the HIV epidemic really blossomed, and a major effort was made to respond to that epidemic, both in terms of strengthening capacity of countries to diagnose HIV in different ways, protect the blood supply, so eliminating transmission through blood, beginning the steps towards eliminating transmission from mother to child, eliminating vertical transmission. And until today, we have largely brought the HIV epidemic under control. In the English-speaking Caribbean, still the island of Hispaniola has some particular problems, and there are vulnerable groups, men who have sex with men, and other groups where this needs to have continued attention until we finish the fight against HIV. So I would say under CCH2, that's one of the highlights of that period. Around the end of that period, saw the Caribbean Commission on Health and Development reporting out on the super priorities in health in the region, which included HIV and AIDS, included the chronic non-communicable diseases, and health consequences of injuries and violence. And that leads us into CCH3, Phase 3, in which we're currently working. And perhaps the most notable achievement there was the very high level political commitment in 2007 of CARICOM heads of government to the prevention and control of non-communicable diseases. And they issued the Port of Spain Declaration on NCD, uniting in the fight to stop NCD, which led to the landmark United Nations high-level meeting on NCD in 2011. I had the privilege to be working with PAHO at that time in Washington and helping to prepare both the Port of Spain meeting of CARICOM heads and also the hemispheric inputs into the global high-level meeting on NCD. And that focused on hypertension, heart disease, stroke, cancer, diabetes, and chronic respiratory disease, which, as most people in the audience would know, are driven by problems of tobacco, poor diet, harmful use of alcohol, and insufficient physical activity, which in turn are determined by big changes in the way we live and the way we work and the way we play. So in talking about a new vision for public health for the Caribbean, I thought it was useful to just reflect on this, that the Caribbean has faced major problems before and has banded together to gather the evidence, make the case, and mobilize responses against major problems. I guess part of the new vision for public health in the Caribbean is in fact the creation of CARPHA, the Caribbean Public Health Agency. Many of you would know it is a merger of the 5 former regional health institutions, namely the Caribbean Epidemiology Center, which was the biggest of the 5, the Caribbean Environmental Health Institute, which is headquartered in St. Lucia, the Caribbean Food and Nutrition Institute, headquartered in Jamaica. That was decommissioned last year, October, and merged into CARPHA. The Caribbean Health Research Council, based in Trinidad and Tobago, and the Caribbean Regional Drug Testing Laboratory in Jamaica. So in that umbrella of 5 agencies, making up CARPHA is part of the new vision for public health. In a way, therefore, CARPHA is a major expression of Caribbean cooperation in health and the principal instrument now of Caribbean cooperation in health. It's about a $4 million a year instrument, US dollars, that being the core budget that the governments invest in this enterprise of public health in the Caribbean to build on previous successes. I think when we look ahead at what CCH4 might encompass and what CARPHA will have to tackle, there are a number of challenges that the region faces that I would mention. First, in talking about the Caribbean, perhaps I should clarify that most of my remarks refer to the 24 countries of the English and Dutch-speaking Caribbean and Haiti, which is also a member of the Caribbean Public Health Agency. This is a region mostly of small states, of middle-income states, with a few exceptions. Countries like Trinidad and Tobago, Barbados, Bahamas being classified as high-income countries, although there persist many problems that are from other groups of countries, and Haiti being the only low-income country in the group. But mostly small states, overall very dependent on tourism, with over 25 million stayover arrivals last year and another 20-30 million cruise ship arrivals. So many more people come to the region than actually live here. And that tourism dependence and the vulnerability of the industry to disease outbreaks, to environmental health problems, is one of the areas where I think CARPHA, as part of the new public health vision, will have to put quite a bit of focus. The only way measles, for instance, having been eliminated in our region, the only way measles can come back is through importation, more than likely through some tourist who brings it back in their children. So that travel, intense travel, means that we're at risk of bringing emerging infectious diseases that have started somewhere else in the world coming back here, and the need to maintain good vigilance, the need to have good laboratory diagnostic systems, and sharing information among us all, both the English and French and Dutch and Spanish-speaking Caribbean, will be important in order to protect the health of our people and of visitors, and to comply with the requirements of the international health regulations. Another major challenge that I've alluded to is the issue of non-communicable diseases and obesity. Childhood obesity in particular coming for a lot of concern, anywhere between, at the last CARPHA Scientific Conference in April, anywhere between 20 to as much as 35% of children aged 12 to 16 in Caribbean schools are now overweight or obese. This is not a good situation. A child who's overweight or obese is almost certainly going to remain that way. It's very difficult to deal with, and problems with hypertension, diabetes, cancer, mental health problems, job-related problems are there for the future. A third category of problems that we face in the region are injuries and violence. And in many of our countries, it's fair to say we are experiencing epidemics of homicide compared to 15 or 20 years ago. And that drives away foreign direct investment, it affects tourism, and it puts an epidemic of fear on the land where people hide behind burglar bars and hire private security forces, which are not productive uses of resources. So that's another challenge that I think for which there are public health solutions, and to which any new vision for public health in the Caribbean needs to take account of injuries and violence. Issues related to the environment and climate change, I would also highlight as a major challenge facing us. As small states, principally small island states, what is happening with global climate change and global warming has to be of deep concern to every Caribbean citizen and every Caribbean government. These problems are going to have the possibility to undo a lot of the gains that we have made, and they're very much connected. The overconsumption of food and alcohol, the overconsumption of fossil fuels are together causing some of these problems. Finally, I would touch on issues related to pharmaceutical quality and access and regulation. Most people take medicines at some point in their life. Some people, as much as a third of the population, are on medicine on a continuous basis. And the importance of safe, accessible, rationally prescribed and used medications are another area where public health vision for the Caribbean has to take account. This all has to be put together with technologies and taking advantage of the new information and communication technologies that face the region. The demographic shift that we face is also of significance. I mentioned childhood obesity. On the other side, as the population ages, we have an older population that requires more health care, and unless we have good healthy aging policies, in many countries what could actually happen is that health costs could outstrip pension costs, and societies will not set up like that. So we have to put a lot of emphasis on healthy aging so that people, as they get older, are healthier and able to enjoy life and less of a burden on their families and on society. Now, of the problems I've mentioned, the infectious diseases are ones that public health have long dealt with and laboratories set up to monitor. Many of the other problems I've just touched on, non-communicable diseases and obesity, especially childhood obesity, injuries and violence, problems related to climate change and the environment, the hallmark of those is that they involve a lot of other sectors beside health. Agriculture, education, trade, finance, just to name a few, tourism, those sectors are much involved. So that a new public health vision for the Caribbean, I think, has to embrace a lot more multi-sectoral working, a lot more partnership and alliances in moving forward, both within government and with government and civil society, government and the private sector. Not all parts of the private sector. Some parts of the private sector I don't think belong at the table in any dialogue about health. The most extreme example being the tobacco industry. Everything about tobacco is inimical to health. There's a fundamental conflict of interest between public health and tobacco interests, and they don't belong at the table in any dialogue about improving health. So that intersectorality has to take account of as we move forward. I touched on at the beginning that CARPHA is a merger of the 5 regional health institutions. Now, why did the governments of the region do that? There are several reasons. Among them was seeking a greater effectiveness of the arrangement in the region for health, greater efficiency, greater synergy between the 5 parts that made up CARPHA. And for CARICOM as a whole, there's a broader look at the regional institutions in education and health in all the different sectors, and looking at how to make them more efficient and effective and more synergistic. So as the newest expression of Caribbean Cooperation, CARPHA, as the executive director, I'm proud and pleased to be leading the agency. Many of you would know we're headquartered in Port of Spain at the former offices of CAREC in Federation Park, and there are offices in St. Lucia and in Jamaica, the drug testing laboratory. I've mentioned, we're talking about the Caribbean and a new vision for Caribbean health. The other thing I think worthy of mention is that we are on a global playing field. And what happens in the Far East today, or Africa, or South America, can be here in the Caribbean within 24 hours. So that global attention to what's going on globally and tapping into other sources of information and network sharing information has to be part of or is part of the new vision for public health in the Caribbean. Many of you would know that CARPHA has an executive board and a technical advisory committee. In July, we held the first meetings as CARPHA. CARPHA began operations in January of the technical advisory committee and the executive board to look at some of the priorities that I've just been talking about. And next month there will be a serious look at strategic planning and visioning for the way forward. CARPHA's role is to promote physical and mental health. It's to coordinate the laboratory network for the Caribbean and provide reference and referral services in laboratory, helping countries with strategic direction, training, research, helping with emergency response, being a repository of information and statistics, building alliances and partnerships. All that's in the basket of public health in order to prevent disease, promote health, and protect health. Within the agency, apart from myself as executive director, we have Dr. Donald Simeon, who is our director of research, training, and policy development. Mr. Jenna Caprice, who's our director of corporate services. Dr. Babatunde Olowokure, who is responsible for surveillance, prevention, and control. And particularly for the laboratories, a new laboratory director will commence on September the 16th, Dr. Cristina Gutierrez, who, notwithstanding the very Latin-sounding name, is from France. And we look forward to her joining us in the middle of September. I think with Dr. Gutierrez joining us, we're also looking very much forward to the establishment of something that has been talked about for some time, a pan-Caribbean laboratory network that allows us to share information across jurisdictions very rapidly to be better able to detect and respond to problems in a timely manner. Now, in looking ahead at what could be the vision for public health, we've settled on 2025, or Vision 2025, that being a year where a lot of other targets are coming together for what's possible. And what's possible, we believe, is that with effort, working with member states, it's possible to reduce by at least 25% avoidable mortality from the non-communicable diseases like heart disease and stroke and cancer, and reduce by at least 25% avoidable mortality from injuries and violence. I believe it will be possible to eliminate HIV transmission in the region by 2025. I believe, and we should be aiming for a much increased investment in public health, and I make no apology for that. Public health is the most cost-effective part of health in general, and some of the best returns on investment are to be gained from your public health investments. I hope we can see some slowing of the upward cost spiral that governments are facing now as a result of health problems within the tourism industry, to have decreased frequency of outbreaks and decreased economic impact of those outbreaks, and have halted the adult obesity epidemic and begun to reverse the childhood obesity epidemic. I mentioned earlier that between 25 and 35% of children now are obese. I hope we can reduce that by at least 1/3 by 2025. Other perennial problems like dengue, hopefully by then we'll have the long-promised vaccine and have been able to turn our ability to deliver vaccines into success at that time. I hope by 2025 that we've made a huge reduction in a very preventable cancer, cervical cancer, which has rates 6 to 8 times higher here in the Caribbean than in North America. And it is so preventable. So it's one of the priorities, that specific sub-priorities that we will be focused on. How to achieve that vision for 2025? I think a smoke-free Caribbean would be a great start. And several countries have already put smoke-free legislation in place. Trinidad and Tobago, Suriname, Barbados, Jamaica most recently. Health Minister faced a lot of criticism for doing it. He had to back off a little bit, but he has stuck to some of the fundamentals of what has been proposed. We need a lot more engagement through the workplace for screening and education of people. We need to increase levels of physical activity. Children are a particular concern, and I think legislation to reduce the onslaught of advertising of junk food to children will be necessary. Control of the school vending environment, another area. And I don't rule out soda taxes to finance some of this. Industry will scream, but they always do if their bottom line is being affected. However, where the health of children are concerned, then I think we have to act to protect our children. A lot of this will require CARPHA to work at policy level with CARICOM and the various sectors that are in there, trade and economic development, foreign affairs, the finance ministers. And a lot of that discussion has begun with the CARICOM Secretariat and the Secretary General about how we actually achieve some of these. So for example, early next year we will have a meeting of trade and health officials to look at how within trade policy there can be adjustments made to have a less obesogenic environment in the Caribbean. And within the rules of the World Trade Organization, there is quite a bit of scope for doing that. So we'll be having a meeting of trade and health officials to dig into that a bit more and see what's possible. CARPHA will be organizing an annual multi-sectoral meeting, both of health and other sectors, agriculture, education, and so on, to try to get health into other sector policies, but also to show how health can contribute to the achievement of other sector goals. And in doing that, we will partner very strongly with the civil society and with parts of the private sector. Where civil society is concerned, we already have partnership arrangements with several civil society organizations. For example, the Healthy Caribbean Coalition, which is a 40-member alliance of NGOs covering heart, stroke, cancer, but also churches, Rotary, women's groups, Boy Scouts. A range of groups belong to that alliance, and those are stakeholders in health as valid as ministries of health or doctors and nurses that we have to engage. So partnering and developing alliances and developing networks will be important in how CARPHA achieves some of this vision. There are other regional institutions as well. The Caribbean Disaster and Emergency Management Agency, the 5Cs group, which deals with climate change. Those are two in particular that we're in discussion with. The Impact group that deals with crime and security. We're in discussion with them about how some of our public health approaches can complement their security-based responses so that we might have a better chance of reducing, preventing and controlling the epidemic of injuries and violence that the Caribbean countries are experiencing. In the last 20 minutes or so, I've been happy to share with you a little bit about a new vision for public health in the Caribbean, some of the rich history that we have with Caribbean cooperation and health, successes in facing previous major problems. I've tried to share with you some of the challenges we face in the region and the developments at CARPHA, the newest kid on the global public health playing field, and some elements of a vision as we move forward for how we can tackle NCDs and obesity, how we can tackle injuries and violence, maintain vigilance against the infectious disease problems which can arrive here from anywhere in a very short time, tackle some of the problems in tourism, and very much concerned about working with climate change and human health issues. Thank you very much.